IVF has helped millions of women conceive. How does it work? What are the steps needed? I'm Dr. Mario Vega, board-certified OBGYN and fertility expert, and today we will be discussing the IVF process. It all starts with the first consult. In our practice, we ask patients to fill out the detailed history form and send all previous medical records so we can review them during the consult. At this stage, most patients have had previous evaluations and some even failed IVF cycles at other centers. During the consult, the conversation with the doctor will be to review previous medical records, identify any issues, and discuss a potential path forward in your journey in becoming parents. Depending on your case, your doctor may suggest further testing, adding supplements, or taking medications. Once you have your period, you will come into the office for an ultrasound and a blood estrogen level, what is called a cycle start visit. Before you leave our office, you will be taught how to administer the medications that are needed for multiple follicles to grow by our nurses, and all labs and consents will be reviewed. If everything checks out, that night, you will be starting injectable medications. If you live outside Panama, this can be done remotely at a center near your home, or you could also come to Panama Fertility, whichever you prefer. After 3 to 4 days of injectable medications, you will come to the office for a monitoring visit. These visits are quick 10-minute visits where we look at your ovaries and uterus, specifically the follicles in your ovaries and the endometrial lining. After the ultrasound, an estrogen hormone level is measured. These visits help determine the dose of medications to be used, and usually around 4 are needed during the cycle. This can also be done remotely, and if you decide to do this, we are in constant communication with you and adjust your medications as needed. When the follicles reach a certain size, usually between 18 and 20 millimeters, final medication for egg maturation, also called the trigger shot, will be given. This will help us retrieve eggs that are mature and ready for use. 36 hours after the trigger shot, you will undergo a minimally invasive procedure called an egg extraction in our operating room. This is a minimally invasive procedure done under light anesthesia. About 20 minutes later, you will wake up in our recovery room with mild discomfort, and after some observation by our nurses, you will be free to go home or to a hotel to rest. Inside the embryology lab, our embryologists are working hard at identifying the mature eggs from the rest of the follicular fluid. Once identified, they will be fertilized with the sperm either by conventional IVF or by directly injecting a sperm into the egg, which is also called ICSI. The next day, we will be able to see how many eggs fertilized, hence how many embryos you have. The embryos will be cultured for 3 to 7 days, and after this, you can choose to transfer them, to freeze them, or to biopsy them for further genetic testing. The day of your embryo transfer, you'll be asked to come in with a full bladder to be able to visualize your uterus on the ultrasound. The embryo transfer is done without anesthesia and takes about 20 minutes. Patients flying from outside Panama can return home the next day. This is the most exciting and anxiety-causing part of the process. During this time, you are free to return to your daily activities, as there is no evidence that it impacts your chances of pregnancy. Many patients find it helpful to keep doing their daily activities to cope with the stress. Hopefully, after the wait, we will get great news and you are closer to completing your family. If you need some help regarding your fertility journey, book a free online Zoom session and see how we can help you.